Once upon a time, I walked into my doctor's office. With an immense and debilitating pain in my lower left quadrant, I told my doctor I had tried everything from eliminating foods, eating well, and having a great support system throughout school. She palpated my abdomen, making me cry from how sensitive and painful it was to the touch. She then proceeded to sit back and say, "I think you have anxiety and depression. I think we better get you on an antidepressant." Now, this story is not unlike many others. People who jump from doctor to doctor for years, never able to get their full health history across, and spending thousands of dollars to get answers to their pain and suffering. Now, I want to preface this speech by saying that I have a sister myself who wasn't on an antidepressant medication for 12 years of her life, and during that amount of time, combined with so many complementary therapies, was truly able to stay functional and stay alive because of the combination of both of those. So today I want to inform you about what those complementary therapies are, or the technical term being integrative medicine practices. They could very well save your life, as they have saved my sister's. It is the beauty of Western medicine and integrative medicine combined that I come before you now as a licensed massage therapist and a licensed practical nurse so passionately to tell you what integrative medicine includes, how it has benefited my life and can benefit anyone, and why it is so important in order to take back our superpowers of health and well-being, knowing that we can feel better than average. So what is integrative medicine, and what does it include? According to Duke Integrative Medicine Center, integrative medicine is an approach to care that puts the patient at the center and addresses the full range of physical, emotional, mental, social, spiritual, and environmental influences that affect a person's health. It uses a beautiful combination of modern healthcare practices to diagnose and treat a patient. So I would bet you my last dollar that each of you have used these therapies in your life without even realizing it. They can include animal therapy, yoga, meditation, guided imagery, counseling, acupuncture, aromatherapy, and my favorite, of course, a massage therapy. Now, massage therapy is so much more than your typical spa massage. It can include deep tissue, massage modified for cancer patients, or lymphatic massage. Lymphatic massage is a type of massage that uses light, gentle techniques to improve the circulation and the movement of lymph throughout the body, where a lot of times it can get stuck and linger. Our lymph system contributes to adequate perfusion throughout the body and helps us to fight off infection. So by simply engaging in massage techniques and getting that fluid moved through our bodies, we'll truly get it to the tissues and the muscles that need it most, decreasing muscle tension, decreasing swelling, and really getting adequate oxygen and fluid to the brain in order to think clearly and have better cognitive function. Plus, overall, you're just going to feel amazing, and it's a great practice to let go, melt into a massage table, and become grounded with yourself. Now, the benefits of using these practices have been limitless to me over the course of seeing them work in people's lives for 3 years now. Coming back to the story of my sister, she had to wean off her antidepressant medication this year because her body had built up such a resistance to the medication that she was starting to show symptoms again to a non-functional level. So what she was able to discover during this global pandemic year was ketamine clinics, where a nurse anesthesiologist or a nurse anesthetist provider gives a slow injection infusion of ketamine. Ketamine is a drug that prompts connections to regrow between brain neural pathways and cells that are involved in mood. It basically works on with the neural pathways to attach to the receptor sites, where normally on those receptor sites would attach sensations of pain or sadness. So people who suffer from PTSD, chronic pain, depression, they have scattered brain pathways, and by being able to actually regrow those pathways, they have a higher level of functional ability and healthier functional ability long term, instead of simply using a medication to mask those receptor sites for a period of time. Plus, medications, as my sister has told me, come with their whole line of side effects that anyone should have the right to know and be educated on. While an infusion runs, aromatherapy also plays an immense part in the experience. Essential oils can actually reach past our blood-brain barrier, protecting our brain in 20 to 30 seconds, helping us to unwind or process our thoughts. And also, the room is set up so that the doctor can be in there while the infusion is running, providing fully guided imagery for anyone that just wants to go to their happy place or help deal with unmet trauma. My sister has seen such a mass improvement over this journey in the past 3 months, using less pain medication for her chronic pain and able to enjoy the hobbies that she has always loved. Now, I hope with this last bit that I can truly shift your mindset to be able to grasp just a glimpse of how empowering it can be to not only put your money where you want it, but to have it outcome in only positive ways. According to Mike McCluick, expert on covering health, pharma, and medtech, the U.S. pharmaceutical revenue was $491 billion in 2019. Now, I would probably be sent to my grave to see what that number would have been in 2020. And I don't know anyone in the pharmaceutical industry or quite how drugs are produced and created and at the rate at which they come onto the market. But pharmaceutical drugs have indeed improved the quality of life for so many individuals who suffer with seizures, heart conditions, or depression. But what I could tell you is the name of probably 20 plus individuals who I've worked alongside with or gotten care from that have worked so hard, sometimes even 6+ years, to gain an education in their health specialty and provide such a deep, real passion for patients to get them on a greater path of health. The shift begins by seeing an investment in complementary modalities like buying a yoga membership, getting a massage once a month, or simply buying a meditation app as an investment in our long-term health. In a quote I once read, "If you don't make time for your wellness, you'll be forced to make time for your illness." If you take nothing else from this speech today, I hope you will take this thought. Integrative medicine is one of the most progressive ways to go about tackling healthcare in this day. It has saved my life, my sister's, and could very well save yours by introducing even the smallest modalities. It is the individual act of taking your health into your own hands because you can know that you can feel better than average, and it's truly empowering. It benefits us all to know to be in control of what goes inside our bodies every day and take back your superpowers of self-advocacy and self-love that will drive us to a better future. Thank you.